For insulin pen administration, you will need alcohol swabs, clean gloves, pen needle, insulin pen, and hand sanitizer. First, perform hand hygiene. Organize your supplies on the bedside table. Take lid off of the insulin pen and swab the tip using friction with an alcohol pad and allow to dry. Next, take the pen needle and insert it onto the insulin pen. Twist to tighten. Now prime the needle with 2 units of insulin by turning the dial to select 2 units and press the button on the end of the pen to prime. Next, turn the dial indicator to select the amount of insulin to be given to the patient. Select an injection site and clean with an alcohol swab. Perform hand hygiene and apply clean gloves. Take lid off the needle. Pinch skin to create a small bulge. With firm pressure, insert tip of pen needle into the pinched skin. Stabilize needle while maintaining downward pressure with one hand and place your thumb on the button of the pen while gripping the pen with your other hand. Slowly press the button on the end of the pen to administer the insulin. Press until the button is pushed all the way down. Hold for 10 seconds. Then remove pen from patient and place an alcohol swab over injection site and apply gentle pressure. Unscrew needle tip from pen and place into an appropriate receptacle. Clean up supplies and perform hand hygiene. Many insulin pens have a clear area where you can see the remaining amount of insulin. The tip is where you swab for placement of the needle. Take the tab off of the needle to expose and insert needle directly into the pen and screw on to tighten. Remove plastic sheath for administration. Twist the selector for the desired amount of insulin. In order to prime, you will need to select 2 units. Press the end of the pen and you should see insulin appear at the tip of the needle. Now you can select the amount of insulin needed to be given to the patient. There is a clear end around the needle that will retract once pressure is applied during the insertion into the patient. As you remove the pen from the patient, the plastic sheath then covers the sides of the needle to prevent needle stick injuries. Twist off to remove and dispose of appropriately.